was when the dogs could see the light, they coped better. They would brace themselves. They would know to anticipate a shock. But the dogs that didn't have that prediction developed uncontrollable anxiety. They developed ulcers, and many of them died. And so just having the prediction of the environment was helpful in being able to survive the event. And we see that in medicine all the time. We try to help our patients predict what to expect. We talk to them about side effects of medication, what the course of treatment might look like. All of that gives them a prediction as to what to expect as they get better or as they manage their diseases. And this helps them to be able to exert their wellness. We need that too in our environments, that when we have situations like if we know that we're going to have a busy day, it's helpful to know that in advance versus walking into an already chaotic situation with crisis after crisis after crisis. The less control we have, the more vulnerable we become to things like anger, anxiety, depression. And the second one is control. In a real world example that you're all probably familiar with, in fact, I'm sure you're aware of it, is we give our patients those little buttons in the SI or in the other ICUs so that they can control the infusion of their own painkillers. So we basically tell them, anticipate the pain when you start to feel it, press this button, and you get a injection of morphine. The reason we give them that button isn't so that they can kind of constantly be giving themselves. It's simply so that they can control their own experience of pain when it happens. And by doing that, what we see is people do better when they can control otherwise uncontrollable situations. And you see this all the time in your daily lives with people who don't have a lot of control in their lives, especially if they're working more menial labor kinds of jobs. Think about the last time you shopped at a Walmart or went to a McDonald's, people who may not have a lot of means, but in that one individual setting where they can exert control, by goodness, they're going to exert that control. And they can become authoritarian in those situations, bark orders, become intractable and kind of working with customers. And that's simply because they are exerting a wellness coping strategy of, I can't control other aspects of my life, but I can control this. And if we feel that we can't control things in our environment at the hospital, what's going to happen undoubtedly is we're going to start exerting controls in the ways that we can, and we might become very difficult to be around, intractable, authoritarian, barking orders at people, not because we're mean people, but because we're trying to exert some control so that we can try to manage some of the stress that we're experiencing. Now, there's three kinds of overall events that can lead to trauma for us. And not surprisingly, some things are scheduled. Knowing that we're going to do a compassionate wean with the family in 5 days when they've said their goodbyes. Okay, we can schedule that. We know it's coming up. It's predictable, and we have some element of control over it. Sometimes it's short notice. Sometimes, hey, we've got this really big case coming up. It's going to start in a little bit. Get yourself ready. We're going to be in the OR for the next 8 hours. But knowing it's coming up and not having a lot of time to prepare for it. And then you get the really big situations that are completely unexpected, like mass casualty events in the hospital or sudden unexpected news breaks, similar to last week when we all found out that Wolfson was going to be changing their contract situation with the UF. That kind of hit us all like a ton of bricks on Monday when we all got that email, right? Unexpected and at least in terms of the news, but scheduled in that we know we have until next March to prepare for it. So some of these things overlap, but we all experience these kind of potentially traumatic scenarios. Sometimes we know to expect them. Sometimes they're thrust on us and we have a little bit of time to prepare, and sometimes they're unexpected. And what's important here is all three of these give us different ways of managing our response to it and also controlling our overall wellness. And to talk specifically about that, when something's chaotic, when something is overwhelming the system and we don't have any time to manage it, and it just descends on us, what we first need to do is determine, is this hazardous and violent and volatile right now, or is it safe but chaos, kind of like a code in the trauma center, in the emergency department, or in the ICUs? And we're going to handle those a little bit different ways. If it's a hazardous situation, we need to fall back on our training. And the very first thing is we all should have a crisis response plan. When chaos erupts, what is the chain of command? Who do you report to? What is your role within that? Who can you hand things off to? We have people at different levels within the residency, from interns all the way through the more advanced residents and chiefs. And so we know there's a chain of command there. You know, they hand off to your faculty if it overwhelms that situation. You know who your chair is, you know who your program director is. Those kinds of things help us to begin to navigate what is going to happen. If you ever watch a code, or if you're ever a part of a code in the ICU, it looks like complete chaos to the person who's observing it. But the people who are in it know their role. They know who's going to be administering CPR, who's going to be administering medication infusions, who's going to be monitoring. All of that stuff is clearly delineated. So when we can fall back on our training, it helps us fall into a way to cope with these hazardous and volatile situations. We need to have clear communication channels. You need to know who to report to. So not everyone is going to the same person, and overwhelming that part of the system. Probably the most important part of this is we need to prioritize our safety, the safety of our team, our safety of ourselves as individuals. Back in 2010, after the earthquake in Haiti, I was part of a medical response team that went out 2 days after the earthquake. The very first thing we did was determine who we were going to have come with us to take care of our team from a safety standpoint, so we weren't overrun, so we weren't being mugged, so we weren't being held at gunpoint. And we hired two people from the FBI to do that for us. And basically, that made it possible to do everything else we needed to do. And then we also, my team brought along a psychologist because they knew that the well-being of the medical providers were going to be at vulnerable and at risk, and they wanted somebody to be there to be able to help them process that. To the extent possible, we want to take some deep breaths and stay calm and composed. We need to be adaptable and flexible because in a hazardous, volatile situations, things change without notice, and we have to be able to allow ourselves to be caught up in that and to adapt as the situation needs. Utilize available resources, meaning we need to know what is available, what's not available, and we need to trust that the available resources are going to do their part of the job, meaning we have to trust other people within the team to be able to hold their end up while we do what we are mandated to do. And then we also want to maintain transparency and accountability, meaning it's a hazardous situation. We're going to make mistakes. We need to own those mistakes, know when they're going to happen, accept that they're going to happen, and then work through them rather than try to cover them up and make a small mistake into something much bigger. So again, these are the hazards, volatile situations that are that we did not predict. We are not having a whole lot of control other than things you see on your screen. But at the same time, we see our role in it. We carve out that narrow niche for ourselves and we thrive within that niche. Now, let's say it's still chaotic, but it's safe. So we don't have to worry so much about making sure we have security around us, no one's walking around with weapons brandished, things like that. This means there may be some time to be able to step back from the environment and to focus on our own individual safety, our own individual wellness. And the very first thing we need to do is we need to slow things down. We need to simplify an otherwise chaotic scene. So whenever I used to get called down into the trauma center when I was working for trauma surgery, I'd walk down and people were running around and doing things. And I had to take in the situation. The very first thing I would do is take a long, deep breath. I'd find out who was in charge and I'd ask, what can I do to help? Finding out what the most simple thing is that I can do to be part of the solution versus just trying to figure it out myself and just jumping around, maybe in places I wasn't needed. So take a moment, give yourself a chance to absorb the scene around you, take some slow, deep breaths. It's going to signify to your internal well-being, hey, I don't need all this adrenaline right now. Let's just slow the whole thing down. And then we need to be mindful about the present. We need to focus on what's going on here and now and try to just take it in without judging it, try to take it in without acting, try to take it in without reacting, and being mindful of what our triggers are because we're going to have those and try to work through those without contributing to the chaos. This disassociation thing here, a lot of times we think of our dissociation as something bad. We think about it as having something to do with psychotic disorders or schizophrenia. Dissociation basically means kind of letting yourself get out of a situation outside of your own body. And that can be a good thing when we talk to ourselves. What we found is in problem solving, people who talk themselves through situations usually have a better success rate than people who are silent. Talking to yourself is a form of dissociation. Dissociation, if y'all have been following any of the research that's coming out of hallucinogens and mushrooms and things like that as treatment for for trauma, that's all because it allows this hallucinatory experience and allows people to dissociate, and that in and of itself can be curative and calming. Now, I'm not suggesting that we need to do mushrooms before we go into a chaotic environment. What I am saying is we need to roll ourselves back and think of ourselves as just a cog in a much bigger part of the machine and focus on just that individual area and allow ourselves to get wrapped up into the moment, to get into your zone and not be thinking too much about all the extraneous things that's happening around you. And then also have a positive chant. Say, I've got this. I'm calm. I'm trained for this. This is where I thrive. Be your own cheerleader. Talk yourselves up and make it deliberate. It may feel a little bit contrived, but people who talk themselves through in a positive coaching manner oftentimes A, do a better job, and B, walk out relatively unharmed from a wellness standpoint. We also want to use visual imagery to the extent possible. If you have a moment, close your eyes and just imagine your peaceful place, your safe place, whatever that is for you. Different people have different ideas of what this might be. When I used to work in the prison system, a lot of these folks came up with some adult-oriented imagery. Fine. If it worked for them, it worked for them. A lot of people down here in Florida like to think about laying out on the beach. That's awesome. If you like being in the forest, if you like fishing, bring yourself back there mentally before you open your eyes. Take some long, slow, deep breaths, get yourself into a visual place, and then proceed. Um, a lot of folks talk about physical activity as this awesome way to release that frustration and that tension and that stress. So going to the gym, stretching, walking, running, whatever that physical activity is, what we do know from a wellness standpoint is the more cardiovascular fitness you engage in, the easier it is to get sleep, the more restful that sleep is. And we know that being asleep sets you up for a successful day ahead, and that people who are deprived of sleep oftentimes really struggle the next day. Again, this isn't earth-shattering science for you. We're just saying physical activity has this two-pronged approach. One, it works off nervous energy, and two, it can help you have more restful sleep so you can engage more thoroughly the next day. It is absolutely essential that we schedule breaks. Um, People will basically, especially in medicine, so many people will just kind of work and work and work and work until they drop. Ask any attending how much leave they have banked, that they could take off. And most of us will say, well, I've got about 6 months of sick leave and 3 months of vacation leave saved up. So I personally am walking around with 11 months of leave that I just don't take. So I'm not saying I'm great at practicing this either. But that's not healthy. We need to take breaks to step away from stressful situations, to reset. And they don't have to be the big things like going on vacation. Just saying, hey, I need to go and grab a glass of water. I'll be back in 5. That's okay. Those breaks help us reset, restart, come back and be at the top of our game or near the top of our game. It's okay to take a break. And the reason that most people don't do this is we think taking a break is letting our team down. It's abandoning our team. And that's not actually accurate. Taking a break actually makes you more effective within a team. So we need to rotate through and make sure everyone is taking breaks. So watch your own well-being, but also look at the well-being of each other and say, hey, you haven't taken a break in 2 hours. Why don't you go grab a drink, come back? Why don't you go take a restroom break? Why don't you go whatever? If you're the kind of person who carries stress in your hands, which many of us are, your hands shake or you're always fidgeting with your fingers, get something to occupy that stress in your hands, like a stress ball or a fidget toy. For me, anybody who knows me or has been a client of mine in therapy knows I carry a pen or a pencil in my hand and I just roll it across my fingers. It's the way I manage my own stress in my hands. Many, many, many of us carry stress in our hands. We twirl our hair, we scratch, we tap our hands, or we do that kind of thing. Find a way to channel that into something that may not be as destructive or as distracting. Music, calming music, can be especially relaxing and especially prone to helping us calm down after a busy day or during a stressful event, even during. I tell a lot of my folks that are suffering from anxiety or having a really hard time winding down when they get home, use Spotify and get into an easy listening music kind of thing on your way home. Listen to that and see if it doesn't have the effect of relaxing you. So when you get home, you can be more mentally present there versus listening to talk radio or NPR, things like that. Yeah, it's great to be plugged in. I think that's awesome. But your own well-being should come first. And listen, music has a very, very natural way of helping us disassociate and helping us cope with the stress of the day. And then we need to make sure we don't isolate ourselves. And what this really means is You are in a very unique situation in your job role. There are very few people out there who are as highly trained as you are. There are very, very few people who actually work around sick people. It is very uncommon for people in the world to be working in an institution where it's not uncommon for people to die in the hospital. It makes you truly remarkable at what you do, which means there are very, very few people out there who are really going to be able to understand what that is and what it's like to work those kind of work shifts you get, or what it's like to be on the rotation schedule that you're on, or what it's like to have to do a research project or write a grant or those kind of things. And so connecting to other people who know what it's like to walk in your shoes can be very, very liberating and very supportive. But even absent that, having friends and family that you can go to, they may not get what it's like to work in the hospital, but they can be there for a shoulder to cry on, or just to grab a quick drink with, or play a game of pool with, or watch a movie with. We want to make sure that we're reaching out to people for support. For those of you who are pet lovers, if you have a dog or a cat or any other animal, or if you know what a pet is, if you know people with a dog or a cat, when you have a sick animal at home, or an aging animal at home, it is common for that animal to go and curl up under the bed or in a corner in a remote room or things like that when they reach the end of their life or they feel really sick. That's an evolutionary response. Those animals know, or no, evolution is designed that those animals are the weak animal in a herd, and they put the whole herd at risk. So, from an evolutionary standpoint, when we feel sick, infirm, or dying, we separate from the herd so the herd is safe and we go off to die alone. That's nature. That's evolution. Human beings have a very similar way of being that when we start to feel lousy, when we start to feel overwhelmed, when we feel stressed, when we feel sick, we go off and it's not uncommon to sit in a corner, to go off into a room, be by ourselves, darken the lights, turn on whatever. We're essentially going off to die alone. And this has the effect of cutting off the single best line of support we have, which is other people who care about us and we care about. So when we start to feel that we need to isolate, that we need to walk back, one, that's a red light warning sign that we are feeling overwhelmed, that we are infirm, that we are not well. And two, we need to overcome that and re-access our support system. And it may be uncomfortable to do that. You may be thinking, man, I really don't want to go out to this dinner. I just want to stay home. Sometimes we need to kick ourselves in the pants and get out and do it, because that safety net, that social support system is what sees us through when we're starting to feel sick, when we're starting to feel unwell. It's also important to acknowledge, hey, what I'm feeling right now, this is normal. It is normal to feel overwhelmed in these kind of environments. I am not weak because I'm feeling stressed out. I am not somehow not up to the task. It's not like I'm falling behind my peers. And how we feel is also important. These are indications that we need to make some changes. We need to tweak the system a little bit. And so many of us will fight back. Because that's what we've learned in life is you power through things. If you're really tired right now, just power through it, get to the end of your schedule, and you can rest later. Okay, we've been trained that. We've been trained that in school. We've been trained that at work. We've been trained that with our friends. The problem is when the enemy is inside of us, when it is our own emotional well-being, when it is our own anxiety, our own frustration, our own sadness, our own depression, you can't bully those things into submission. The more you try, the more we cover them up, the more they affect us in ways we cannot control. I frequently tell a story to my clients. When I was working on my dissertation, I went to Illinois State University. I was down here in Jacksonville. It was really hard. I wound up spending a couple of years just working on my dissertation. We call that ABD, all but dissertation, so I didn't have my degree yet. And it was absolutely maddening and frustrating. And the day I defended my dissertation, which was in October of 2004, um, I flew up to Illinois. I successfully defended it. I was staying at a hotel. I dropped my final draft off at the printers. I get into my car to drive to the hotel. It was pouring outside, and as I was driving, I had to pull over because I started uncontrollably crying. I wasn't sad, but I could not quell the tears. I was just heaving and sobbing in the car. Fortunately, being a psychologist, all of my friends are psychologists too. So I called a friend of mine and said, "Hey, so this is happening." And she said, "Dave, you have been working on this dissertation for the past 4 years, and none of us knew how much it was affecting you. And now all of a sudden, you're kind of vulnerable at the end of the day. This is how all of that emotion is coming out. Thank God it's coming out as tears. Think of all the different ways it could come out of you. This is probably the one that's least invasive." She said, "It's because you didn't effectively deal with that emotion in small bits during the process." And she was 100% right. I think about this frequently. If we deny our emotions, your brain's not stupid. It knows it's got to deal and process these in some way. When you bury them and force them down, it's going to deal with them in a way that you may not have any control over them because emotions will out. So if we stop fighting them, and we stop fighting all of those cues and all of those warning signs that our brain is giving us that we are overwhelmed, that we are not well, then we can start to accept them. We can normalize them and we can deal with them in a healthy way and integrate them into the moment. Um, and then all this other stuff, it's normal to feel guilty if you need to take a break, but you need to take breaks. We talked about this before. Practicing self-care actually benefits the entire team. And so what we want to do is make sure we're at the top of our game. We're looking out for everyone else so they're at the top of theirs. Think about the people working alongside you. Would you rather them being exhausted and working without breaks or refreshed and having just taken a 5 minute break? The answer should be fairly obvious. It's not always feasible. In the moment that everything's dangerous, maybe you can't take a break. But when you can, this is how we reset. And then the three strategies for surviving trauma. I used to tell this to people all the time, family members, when their loved ones were in trauma. Do these three things. They're simple, they're easy, they're not complicated, but we tend to forget them. We need to hydrate first and foremost. I used to tell people you need to drink, but people were misinterpreting what I meant by that. So now I actually say you need to drink water. You need to hydrate, stay hydrated. You need to eat, get calories in your system because it's natural for all that adrenaline in your system to shut down your desire to eat. And so we wind up getting low blood sugar, getting headaches, kind of crashing ourselves. So drink lots of water, make sure you're getting some calories in the system, and also take time out to rest. Even if you can't fall asleep, just sit in a darkened room and rest your eyes. Those three things is how we survive trauma. It doesn't have to be any more complicated than that. So just threw this up on here so that y'all kind of got a sense of what resilience looks like, because oftentimes we use these terms and don't really define them. Resilience has three broad areas. It's how interconnected we are in our relationships with ourself, our loved ones, and our community. Over on the left side, self-care. It's what we do for ourselves, body, mind, and spirit. It's important here that spirit one is often misunderstood as that means you have to go to church or synagogue or wherever else have you. That's not what it means. It means be connected to something bigger than yourself. I personally am not a person of faith, but I find a great deal of solace in spirit. I think of the universe itself as having purpose in design, and I try to connect to that. By doing that, it kind of frees us up to kind of see meaning where as we're working forward, which gets into the life purpose side over on the right. Finding what are we working toward? What are our passions? What are our major life goals and values? What is our overall meaning? What is the purpose of our lives? All three of these things together work in harmony, and what we need to do is utilize that as the compass for why we're doing what we're doing. And the more connected we are to these 9 areas, the better off we're going to be, the more resilient, the more well we're going to be. And if there's an area on that wheel that doesn't seem to be getting as much attention from you as it probably should, it's time to focus on that. It's time to try to drum that one up and reinforce it. One of my colleagues talks about the ABC of building resilience and what that looks like. Now, secondary trauma is kind of after the trauma has passed, or if trauma has happened to somebody else and you're bore witness to it. Um, how do we manage that? And my colleague basically talked about the ABC. It's the first, the A stands for awareness. And what awareness basically is being aware of your needs, being aware of those areas in your life that maybe you're not as attuned to. Maybe you're not building up as much as you should be. Are you getting enough sleep? Are you taking regularly scheduled breaks? Are you exercising? Are you doing the things that are important to you to keep yourself healthy? If you're eating enough, are you eating stuff out of a vending machine, or are you eating something that's nutrient dense? Making sure that you're just aware. And awareness is the first part of any major life change. If you've ever struggled with finances and you talk to a financial advisor, the very first thing they're going to do is say, I need you to keep a finance journal. Know where your money is going. Know where those bills are coming from. Know how much you're spending at the end of every month and how much in the red or how much savings you've got. Because unless you're aware of where you are spending that energy, you're not going to be able to make effective changes. And that's really what we're talking about with resilience too. Where are your leaks in resiliency? Where are your surpluses in energy, in wellness? And then if we need to shore something up, then that's where we want to focus our attention. And we need to prioritize taking care of ourselves once we find out this is the area that I'm not doing so well. Maybe I'm not getting enough sleep. And in medicine, this is a pretty frequent complaint, right? So it means we need to find time to do that. We need to look at our schedules, find, can I sleep here? If you're the kind of person who benefits from naps, when can I grab that quick nap? If it's food that's a problem for you, what can I do? Can I meal prep on the weekend? Can I bring a healthy snack somewhere in the middle of this? Can I find a place that I can go to do this? Creative outlets, appreciating nature, having fun and laughing. Basically, this is finding the things that you enjoy, and it's going to be very different for each person. So, unique to you, what are your outlets? What do you enjoy? Where are your passions? And plug into those. Ideally, you can do that with other people, but if other people don't share the same interests as you, maybe it's something that you either look for a different group that you can hang out with, or you can do those on your own. So B stands for balance. And balance, you've all heard the expression work-life balance, which we're trying to get away from or talk about in terms of work-life integration. But balance is finding those work boundaries. The person I work most closely with at the hospital is Dr. Mark McIntosh in the emergency department. He's your director of employee wellness. And I frequently scold him because he's the kind of guy who always raises his hand to volunteer and then bemoans the fact that he doesn't have a lot of free time. And I try to do the exact opposite of that is try to, if it's not something I'm interested in or not something I'm very good at or not something I want to do, I try to really work on being able to say no to people if it's not something I want to be a part of. We need to find that balance of volunteering for the things that we enjoy and that we have time for and that we think will raise us up and liberate us, and also saying no to the things that are going to get in the way of that balance. We need to prioritize socializing, not only with coworkers, because when you prioritize the coworkers, you're talking about work an awful lot, but we also want to make sure that we're finding free time to socialize with other people that don't have anything to do with medicine so that we can actually feel like we're growing in ways that don't necessarily have anything to do with going and clocking in at work. We also want to make sure that our goals are realistic and manageable and short term. It's important to have long-term goals, but it's also important to have short-term goals because long-term goals, 10 years from now, this is what I want. Fine. But the problem is you got to wait 10 years to get there. There's going to be a lot of obstacles between now and then. Want to have shorter term goals. Maybe by the end of July, I write the first draft of a paper I'm working on or something to that effect. Knowing our limits, working around them, not trying to bully through them, and accept. There are some things I simply can't do. But those goals need to be realistic and they should be obtainable in a relatively short period of time. And then having some overarching goals for a long time, but those we don't focus on so much. We really need to focus on the short-term stuff, which are really the stepping stones to get to our long-term goals. We need to practice time management skills. Time management is so important. Some of us naturally do this and we're really good at it. Some of us aren't. I was just talking with the dean this week about some people just are temporarily can't challenged. They cannot be at things on time. They're always the people walking in 15 minutes late, even though they set their alarm 20 minutes early and they try to, but for some reason, that's a challenge for them. All right, fine. Understand this about yourself, work through that. Find ways and skills to either overcome that challenge or to make it a part of who you are and get the things done, even with that as an obstacle. But know yourself, know your own management skills. Make sure that you're spending time doing things that are fun, that have nothing to do with what you do for work. Again, we want to keep those two things separate a little bit so that you can decompress and recognize your negative coping skills. And when I used to lecture just on coping strategies, one of the things that I talk about, a very frequent coping strategy in medicine is using illegal drugs or drinking too much to unwind. Yes, that is a coping management skill. yes, it will lead to long-term problems for you. And so those coping skills can actually be more problematic than the things you're coping with. And so if you're the kind of person who drinks too much when you get home to try to unwind, it's time to find something else to substitute for that. If you're the kind of person who overeats when you get stressed, maybe food's not an effective coping strategy for you. If you're the kind of person who, whatever, and it's getting in the way, maybe it's time to look at other coping strategies, find what those are. Now, how do you find those? Well, one, you could talk to a mental health counselor like myself. Two, you could talk to your peers about how they cope with what they're going through. Or three, you could just get online and start looking for things that you enjoy that won't get in the way of your being successful and won't potentially put your overall career at risk. And last, you've heard the saying, or you may be familiar with the saying, perfection is the enemy of good. And it's true. We are never going to be perfect. Um, if I do this with baseball analogies a lot, for those of you who are baseball fans out there, or at least know what baseball is, it requires a baseball bat, a baseball, and a baseball glove. Um, a very, very good batting average is 300, meaning that when a batter takes the plate and is going to hit the ball, if they are successful 3 out of 10 times, we consider that a very strong batting average. That means they do their job 3 out of 10 tries. Now think of what the batting average is for a doctor when you go to the OR or when you're managing a patient. What is a good batting average? Being successful 3 out of 10 times with patients? 5 out of 10 times? 9 out of 10 times? It's not, it's 100%, right? You have to be on your game 100% of the time. Guys, that's simply not realistic. It is impossible to get it right every single time. And so there are going to be times that things don't go the way that you expect them to go, and that's okay. It's okay not to be perfect. When things start to go south on you, that's the time that you need to go back, reassess, and proceed. Most of the time, we can course correct and get to where we need to be after mistakes. Sometimes we can't, but we need to cut ourselves and our colleagues slack when that happens. Provided that there wasn't malicious intent, it is okay not to be 100% perfect all the time. Celebrate your small victories and accomplishments. Guys, when you publish a paper, that's reason to celebrate. Go out and toast the accomplishment. When you effectively finish a rotation or something that you've been working towards, make sure you take time out to really acknowledge that this is a big deal and it's something that you enjoyed and it's something that deserves some accommodation. All right, and lastly, the C in the ABCs of resilience is connection. And connection here is really connecting to other people. It's connecting to the things that matter. It's connecting to why we're in this in the first place. I've already mentioned it before, the absolute worst thing we can do is become isolated. Our best outcomes occur when we are connected to other people. And you see this across the lifespan. For any of you who have been interested in geriatric literature lately, or in the recent Surgeon General said that social isolation is the biggest killer of old folk, and it really is. Other people give us meaning. Other people give us that connectivity that keeps us going. It helps us be the best that we can be. It helps us really achieve things that might have otherwise been out of reach. It gives us fresh perspectives. It gives us joy. It gives us enjoyment. It gives us access to activities we might not have thought of before. Now, yes, coworkers on the job we should be connected to, but also we want to make sure that we're connected outside of work as well. On the job, we need to, when something's difficult, let's just acknowledge that something's difficult. Talk about it. And if you can, learn from it. There's the old saying that success is a poor teacher, meaning that we actually learn more when things don't go the way we expect or when things are particularly difficult. Take advantage of that. Surround yourself with people who liberate you. If there is somebody who's constantly tearing you down or constantly,
is that you?
Yes.
well,
Thank you for coming in,
to
coming out here.
cut those people out of our lives to the extent possible, because we really want people who lift us up, liberate us. We want to make sure that we're lifelong learners, that we're constantly trying to improve our job skills and capacity, that we're learning about the things that matter to us, that we enjoy, and that we specialize in, so that we don't just stagnate. Remember the spiritual side. Again, spiritual here is very, very wide opportunities here. Find things that give you purpose. Find things that you can connect to that are bigger than yourselves. And then touch base with that. Now, a lot of people will use religion with this, but it doesn't necessarily need to be religion. When we neglect this, we start to think of the universe as absurd, absent meaning, and that can actually take a devastating toll on our wellness. Um, Acknowledge that there's challenges in helping other folks. When I was first starting off on my career path, my dad, who was in sales, took me aside one day and said, David, you can be anything you want in life. Just don't work directly with the public. It's too hard. And obviously, I didn't take that advice. It's hard. It is hard working with people who walk in the door, and we don't have a lot of checks and balances on who that's going to be. Acknowledge that that's tough, and acknowledge that sometimes you need to take a break from it. Have discussions about compassion and care, what fatigue looks like, what burnout looks like. Talk to your colleagues about this stuff and check in with them, both for your own well-being and for theirs. And then really we need to prioritize our own healthcare and our own self-care activities. So how do we practice self-compassion? What we need to do is we need to be kind for ourselves. For those of you who are religious, or for anybody who's read the Bible or a lot of non-biblical texts, one of the pieces of the New Covenant in Christian lore is do unto others as you would have them do unto you, right? You've heard this. It comes out of all kinds of different religious texts, but also secular texts as well. Do unto others as you would have them do unto you. Not better than you would have them do unto you, which means we need to treat ourselves with the same kindness, with the same forgiving attitude, with the same gentleness that we would treat other people with. And then we should expect that from other people as well. Otherwise, that's a violation of the commandment. We need to stay connected versus isolate because that is how we make sense of the world around us. It's how we learn and grow. And we need to be mindful of the situation as it exists right now and not over-identify that if I failed today, I'm going to fail every time, or if this was hard today, so it's going to be hard every time. What we want to do is take each situation on its own merits, and we want to evaluate it for what it is, and we want to learn from it so that in the future, whatever might have gone wrong or didn't go as well as it could have gone today, maybe next time it's not quite so hard. Now, if it gets to be overwhelming, if things do start to go sideways and we really need someone to talk to, and there's no one that we can find that we really trust enough to do that with, or that we really get us, you do have your Center for Healthy Minds in Practice. I think most of you know who we are, but we offer free, unlimited, confidential mental health counseling and coaching. We don't use Epic. No notes go on your chart. Nobody has to know you're coming over to see us. We're located in the Employee Wellness Center, which is access to the first floor of the South Garage. And the way you get in touch with us is either give us a call, you can drop me an email at the email on the screen, or if you don't want to contact me directly, if you substitute david.chesire with just champ@jackscfl.edu, that'll go to our general email and we'll assign you a therapist that way. We have in-person and virtual appointments. We try to cater across the schedule. We do couples counseling, provided at least one person works for the institution. Our job is to help you be the best you can be. So far, we've been in existence for 6.5 years. We've worked with more than 1 in 7 employees in the Jacksonville arena so far, which means we get all kinds of administrative support. We we get a lot of really good word of mouth, but basically our job is to help you do your job in a non-judgmental way. So we want to make sure everybody's aware that help is available here. For some reason, no, I'm not going to talk to Dave or anybody on his team. We also have employee assistance program that you can access that offers outside counseling. I don't think they're quite as good because they have waiting lists and things like that. But if you'd rather do that, that's fine. We have a psychiatry department here. We have our chaplains that are available to you. We have the coaching center over in UFJPI. I'm sorry, not UFJPI. Basically training and development. And basically, there's a lot of resources, but they don't do any good if they're not utilized. So I want to make sure that everybody knows you have lots of resources here to take advantage of. And with that having been said, I want to thank you for inviting me to come and talk with you today. And we have a little bit of time left that I can take any questions you might have, or if anybody has any observations. So thank you so much.
Hey, David, thank you so much. This is a great talk, and we appreciate you taking the time of your busy schedule to be with us. And next questions for Dr. Cheshire. I guess all of you guys are feeling well this morning.
I may have a question, Dr. Chesire. Thank you again. Also, I would echo that. Thank you for this talk. I'm just looking at an epidemiologic overlook. I've been in medicine for almost now half a century, and my impression is that the load of that of work that is coming our way is growing, notwithstanding our scientific accomplishments and new efficiencies. Do you have any opinion about that? Because I sense that what we call healthcare workers, I would say more like disease care workers, will be expected to put out more and more, and then how institutions react to that challenge of numbers and decreased revenues, I think maybe impacts how we respond to it and how we get organized and how we work together to meet that challenge.
I think that is an absolutely extraordinary question. Thank you. And I'm going to start off before I even begin to try to tackle it. If I could answer that question, I'm going to write a book, and you won't be seeing me here again. I'll be well retired because that one's really tough. I agree with you. The field of medicine has changed remarkably. You've been doing this for half a century. Even the last 5 years, things have changed a lot. 5 years ago, before COVID took hold, we weren't having meetings like this, right? So things have changed so much. Um, I, Going back to a slide that I talked about before is the flexibility and adaptability that we need to have, because things are changing. Our clients are different now than they used to be. How clients respond to medical providers is very different than it used to be. It used to be you just trusted your doctor just out of hand. Now, whenever I talk to my mom who lives up in Chicago, she'll tell me that she does not like her doctor. Her doctor doesn't know what they're doing, and she'll get better by eating a bunch of mushrooms. That's the world we live in. The internet has just kind of destroyed the ability to be confident in medical care. And we need to figure out how we're going to do that. Dr. Marino, I think you were really on point when you said come together, and I think you intimated we need to do this as a team. I used to talk an awful lot about if physicians don't come together to police their own profession, the lawyers will do it for us. And we need to be proactive in what the field of medicine is going to become, because if not, it's going to be outside forces that do that. And so I think what it's going to take is task force within the field of health to decide what's it going to look like? What is going to be the next patient bill of rights? What are we going to allow patients to do? What are their rights? And when do they overstep those rights? And what are the consequences for that? An excellent one is violent patients. We let patients get away with everything up until murder in the hospital, and that has to change. But we haven't figured out how to do that yet. And in fact, I don't know if any of you have ever had the privilege of this. If you call JSO when a patient is abusing you, JSO is going to say, well, they're a patient. What do you expect? And they aren't going to take the case. That's a problem. We need to change that. We need to change how procedures are funded. We need to change how we get compensated for our billing. We need to change. There are a lot of challenges that are going to face medicine in the years to come. I will not profess to know exactly what it's going to be. I'm sure artificial intelligence is going to have a lot to do with it. I am sure that we're going to see a lot of virtual appointments replacing kind of these kind of things. Robotics continue to take more of everything. But at the end of the day, physicians themselves are not going to be replaced, but they are going to need to adapt. I wish I could give you something more firm on what that's going to look like. One, I'm not the kind of guy who runs around with a scalpel. I'm a psychologist. I'm a PhD. I'm not going to try to insert myself, know something I don't. But I'm going to say it's going to change in unexpected ways. We need to be able to roll with that. And we should have a seat at the table and get involved with our professional organizations and as opportunities allow themselves to helping draft legislation.
Thank you.
David, I just had another question for you, both looking at it at an epidemiological level and temporal level. Over the last 50 or 100 years, I mean, change has been constant, and there have been bigger changes in the past than the changes we're experiencing now. The question is, Has indicators of wellness or lack thereof changed over a period of time? Are we going through a phase where there's something more acute happening, or are we just being aware? Because as a resident, we never talked about wellness. This is not something my chief or chair would have invited a to come and give us a talk. So we seem to be more aware of it. Are there any data on the long term that we are in any different stage now than we were, say, 20, 30, 50 years ago?
We talk about this a lot in the I mentioned the group I'm a part of for medical school well-being, and the new generation of medical students and certainly the residents here, they learned wellness in school. Even as a psychologist, wellness was not a word that we talked about. My wife, when she graduated graduate school, was talking to me about a emerging career called wellness promotion. She got really excited about it and did an externship in Northwestern, and that was right around the year 2000. So it's still relatively new. Um, when I speak with younger physicians and students, wellness comes up all the time. Like what can I do to make sure I get adequate sleep, nutrition, that I have social relationships and things like that? For better or worse, that is the way the field is going. And from an individual standpoint, I think it is fantastic. From a institutional standpoint in healthcare, I don't know. I know that one of the things that was a concern was when we went to the 80-hour work week, will our residents be adequately trained after the residency? And I don't see any evidence to say that they're not. But at the same time we did that, we also went more toward a milestone review rather than just a structured, this is how many years it's going to take. My guess in talking with ACGME is those milestones are going to take more and more of a prominent feature, in that it won't be you've got this many years to complete residency. It'll be, you're going to be in residency until you hit these milestones. And so some people who are not able to work the hours and get as many cases may take longer in a program. It's going to play havoc with the programs. I get that part. But I think that might be something that ACGME is going to look more closely at. But wellness is a feature. It's not a bug. And it is something that we need to be mindful of, because our younger folk are just better at taking care of themselves than old fogies like myself. And that's a good thing, but it will have changes in educational practices that right now it's hard to foresee, but I think it's going to have something to do with the milestones.
Thank you. Any other questions for Dr. Chesire?
I have a comment to follow that up, and also I want to also thank you, Dr. Chesire, for giving this talk and for what you do for us every year. And I've heard you speak multiple times now, and it's appreciated that you highlight these things for us. And I think it also bears kind of also emphasizing the changing field of medicine. We are more aware regarding wellness now than perhaps our predecessors while they were training. But I also think that, as you astutely pointed out, that the training experience has changed and medicine has changed. You mentioned physical assault. You now have around 40% of healthcare workers reporting instances of physical assault from patients. And I don't know, because I wasn't around at the time, obviously, but I would wonder if that was as big a deal when some of our faculty were training as it is now. I have a sneaking suspicion it's not, because I think that the respect for healthcare workers and physicians has diminished, and somehow that has become acceptable. So I think that there are training elements too that are certainly changing in terms of wellness, but there are also changes within our society that are occurring, and the long-term data, I think I'm interested in what that shows too. Because I think it's going to be dramatically different comparisons, the training experience now versus the training experience then.
I certainly agree with that. And another element to what you just said, there are more patients now than there were 20 years ago. We have more patients in the same amount of space, and so the crowding becomes an issue. The amount of time that our professionals can provide with any individual patient. We're in more managed care now, so physicians are encouraged to spend less time with any one patient to maximize billing. There's a lot of vectors that go into that, and it is frustrating. And for anybody who's been a patient in a hospital, it's frustrating, especially for physicians and for goodness sake, if you've ever had the pleasure of treating a physician in the hospital, you know it sucks because the physicians know better and they know what it used to be, and it's kind of a throwback. Healthcare has changed. Abuse in hospitals, patient to provider, has changed. Yeah, I would suspect you're right that it's worse now. I don't think it was as reported back in the 80s and 90s as it is now, but there's simply more patients, and so it's more acute.
Any other questions for exercise? Okay, hearing none. David, thank you so much. Really appreciate you being
Thank you
this.
for inviting me. You all have a wonderful day.
Yeah, I thank you and your staff for everything you guys do for us. We appreciate it. Thank
Thank
you.
you.